Class 7, Chapter 2, Role of Government in Health. Civics. Role of the government in health. What is health? Healthcare in India. Public and private healthcare service. Public health service. Private health service. Healthcare and equality. The Kerala experience. The Coastal Rika approach. So, this is the contents which we will learn in this lesson. What is health? In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or development of roads, electricity, etc. Health means our ability to remain free of illness and injuries. But health isn't only about disease. What is exactly health? What do we know about health? Anyone? This is a easy chapter, but if you concentrate on it carefully, you will get to know about this chapter very easily. What is health? My question again. Free from illness and injuries, physically fit, mentally fit, and socially fit. What is health apart from injuries and illness? Apart from disease, there are other factors too that can affect our health. For example, if we drink clean water or we live in a pollution free environment, then we are not prone to illness. If we don't get sufficient food, we will be more prone to sickness. Healthcare in India. Compare and contrast. India has the largest number of medical colleges in the world and is among the largest producer of doctors. Approximately more than 30,000 new doctors qualified is every year. Most doctors settle in the urban areas. People in rural areas have to travel long distances to reach a doctor. The number of doctors with respect to the population much less in rural areas. Healthcare facilities have grown sustainably over the years. In 1950, there were only 2,717 government hospitals in India. In 1991, there were 11,174 hospitals in India. In 2070s, the number grew to 23,583. About 5 lakh people die from tuberculosis every year. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. India gets a large number of medical tourists from many countries. They come for treatment in some of hospitals in India that compare with the best in the world. We are not able to provide clean drinking water to all. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, and etc. India is the third largest producer of medicines in the world and is also a large exporter of medicines. Half of all children in India do not get adequate food to eat and are getting discriminated. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc., that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, to treat illness. We also need the medicines and equipment that are necessary for treating patients. These facilities are required to take care of us. So, also the world knows that we are much important, right? Now India has a larger number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. There is a system of hospitals and healthcare run by the government. It has the ability to look after the health of a large section of its population, sacred over hundreds of thousands of villages. Moreover, there has been a advancement in medical sciences whereby many new technologies and treatment produces are available in India. So we know that the India is the most largest country after China. The story of Hakim Sheikh. Hakim Sheikh was a member of Paschim Banga Khet Mazdoor Samiti MBKMS, an organization of agricultural laboratories in West Bengal who accidentally fell off a running train and suffered head injuries and needed immediate treatment. He spent 14 hours in a critical state while moving from hospital to in search of treatment. He was admitted in a private hospital where he had to spend a lot of money. Angry and upset over the indifferent attitude of all the hospitals that refused to admit him, Hakim Sheikh and PBKMS filed a case in the courts. So why were the all hospitals not actually, the actual reason was that they were refusing the Hakim Sheikh because there were no beds available. And then Hakim Sheikh went in the courtroom. Okay, we always know if there is a case we file it and then go to the court. We also need the medicines and equipment that are necessary for treating patients. These facilities are required to take care of us. India has a large number of clinics and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. Types of healthcare services, public and private. So we know that there are two types of hospitals which are either public or either private. Public, it has the ability to look after the health of a large section of its population, saturated over hundreds of thousands of villages. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment producers are available in our country. Private, RMPS, registered medical practitioners. The resources needed to run the services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality healthcare services either free or at a low cost so that every poor can seek treatment. Another important function of public health is to take an action to prevent the spread of diseases such as TB, malaria, jaundice, chlorella, and etc. This has to be organized by the government with the participation of people, otherwise it is not effective. For example, when taking up a campaign to see the mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area. Recall the case of Hakim Sheikh. The court said that the difficulty that Hakim Sheikh has to face could have cost life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was a duty of government to provide the necessary health services, including treatment in emergency situation. Hospital and medical staff must fulfill the duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give him the money that he had spent for his treatment. Health means ability to remain free from illness in a broader sense. Health is a state of mental and physical well-being. In India, a paradoxical situation exists as our healthcare resources are uneven. India has the largest number of medical colleges in the world. It is among the largest producer of doctors. Healthcare facilities can be divided into two categories: public healthcare services and private health facilities. Public healthcare services are run by the government. It is found in both the rural areas and urban areas too. We have learned about rural and urban areas in class 6, chapter 6 and 7. Private healthcare services are expensive as the patient have to pay a lot of money for every service that they use. Kerala provides good health care to people of the state. Costa Rica in North America is considered to be one of the healthiest countries in the continent. Thank you. I hope you all liked my video.